Welcome. This is another edition of Barbershop Therapy. I'm your host, Jimmy Evans, and I am the founder of the Barbershop Therapy Foundation. We're here to train barbers to be mental health advocates. We're also here as the assistants to young youth that may need haircut vouchers. Unofficially, the space where confidence meets, the ability for these kids to look good, feel good without those vouchers. And with that being said, I'm here today with a special guest, Dr. Keemia Shaw.
Hello.
Dr. Shaw, thank you for being here.
Thank you so much for having me.
I really appreciate your time.
Absolutely.
I'd like to just get a little bit of information about you. Let the folks here in Barbershop Therapy Land figure out who you are. You can speak to that camera right there.
All righty. Thank you so much for having me. First of all, thank you for the work that you're doing. Barbershop Therapy, helping individuals get the mental health services that they need, as well as supporting the youth with necessary haircuts, looking good, feeling good. It makes a world of difference. So thank you for all that you're doing. And yes, I am Dr. Keemia Shaw. I am here. I am a therapist here within the Wake County area. I studied at the Fayetteville State University way back in 1999. And now I have completed my doctoral degree from Capella University in 2025. So thank you for having me.
Thank you for being here. This is awesome. So, little background. Myself and Dr. Shaw have known each other for over...
It's been a long time.
15 years.
Absolutely. More than that.
She was a client of the barbershop.
That's right.
And I watched her grow through this process, and it's been amazing. Now, Dr. Shaw, I remember you have a daughter.
I do. I do.
And being a single parent.
At one point.
And now have a awesome
beautiful
husband.
Blended family, yes.
How is that being for you, going from working hard as a single mom, raising your daughter, finding the love of your life, and working on being married in a blended family? How's that been for you?
Blending is always a challenge. However, when you have individuals who are committed and their goals are set in order for them to create a family, sustain a family, and maintain the growth and development of a family, it's always a beautiful thing to have the opportunity to do. As a single mom, yes, there were struggles, but that is one part of my life that I wouldn't change, because that has created me into the woman that I am today. My eldest daughter, beautiful young woman, she's a stellar student. She's a stellar individual, and she and I grew up together. So she is the reason that I sit here today.
Awesome. So today we're going to talk about communication, right?
Communication, okay.
Which is something in our community, Black and brown communities, that has been a stagnant and sometimes detrimental component and skill set that we don't have. And so I want to get it from your professional and your personal perspective of how communication is valuable, and if not used correctly, will cause the divide in families.
Absolutely.
Right? So
absolutely.
I got a few questions. I'm gonna read from my little list.
Okay, pull your list out.
Here, and it talks about spouse or intimate partner communication.
Okay.
Right?
All right.
And so I'm gonna jump right on in.
Okay.
All right, y'all, bear with me because this is gonna get good.
Okay.
All right. So when conflict arises with a spouse or partner, how do people typically express their needs and emotions?
Okay.
From a personal standpoint and from what you hear from your clients.
Okay. So from a personal standpoint, typically, I'm going to speak from the female's perspective.
Okay.
When we typically go to our male partner, what we may convey can be received as complaining or nagging. So,
No.
Unfortunately, it can be perceived, and sometimes vice versa. If a man comes to a woman with a complaint or an issue, it is, we If you telling me I'm doing something wrong,
Oh.
that posture can be defensive. So one way I try to encourage my clients to communicate with their partners is to use a compliment. You let the person know, hey, babe, or honey, whatever term of endearment you use for your spouse or your partner.
Mhm.
I appreciate when you do X, Y, and Z. You want to lead with the positive, because if you don't, it is easy to be perceived as she's coming at me or he's coming at me again with something that I'm not doing, I didn't do, I haven't done, I can't do. So all of those negative feelings can posture you in a defensive way.
What, like this right here? What you say to me?
Exactly. It really can. So in order to try not to allow that to occur, you want to lead with a compliment. Again, I appreciate you for cutting the grass. I appreciate the way you take care of our family. I appreciate the way that you care for me. So we want to lead, if we can, with a positive.
Okay.
Preferably 3. Because if you can give me 3 positives to 1 criticism, you see how my balance?
Yeah,
I'm already feeding that ego.
I'm feeling a little more confident about where this conversation will look.
It can. That's right. Because we love to hear what is negative. So if I feed you more of what is positive, that has a tendency to stick. If we have more positive than we do negative. And typically we do have that in a relationship. Now, if you have a relationship where you have a barrage of negatives, then we have an issue. So just lead with more positive. And then say, when you don't do X, Y, and Z, I feel. You want to use I statements. Again, that creates an atmosphere where you're telling your partner how you are feeling as a result of what hasn't been done, what needs to be done, what can be done.
Okay.
3 positives, 1 criticism.
My bad. Criticism, not negative.
It could be a negative, but 3 and 1. That's a good way to try to lean into a healthier conversation.
Okay, so when you say the I feel statements, like I got a thing that I try to work in, fact over feeling.
Okay.
Right?
Okay.
Now when people go into the I feel statements, are typically emotional feelings, right?
Okay.
And so if those feelings are not factual, how should the partners deliberate through those moments?
Well, you can't say a person's feelings are not factual.
Oh, okay.
You want to validate the way that person feels.
And how do you do that?
Affirming them. If you're telling me that what I have said or what I have done has injured you in some way, it is not my role to say, now it didn't do that. No, it didn't. You understand what I'm saying? Okay, that is how you feel in that moment. You want to be sure that you hear your partner. You want to validate them.
So that's a part of the active listening.
That is active listening.
Okay.
You don't want to invalidate your partner's feelings, whether they're factual or not. That is the way he or she feels in that moment. And it's not our job to invalidate them.
You sure I can't do that?
You shouldn't. Okay. But some people do. And that's where more and more conflict arises.
Okay.
So you want to make sure that you hear what your partner is saying. You want to hear the heart of that partner.
Okay. So the fact over feeling, when you figure out the facts of that feeling, right? How do you have the open-ended questioning to help validate that feeling? Okay. From the person that is the perpetrator of the moment.
So just for example, if someone comes to you and says, when you didn't close the garage door last night, I felt unsafe. What's your question? How do you want to combat that?
Not necessarily combat it. I think validate the fact of the moment. Okay. Right. And so that was a very good example because you didn't close the garage.
That's correct. That's a fact.
And I'm actually hearing what you're saying.
I felt unsafe.
Put 2 together. Right. And I think a lot of people, when they have conflict, they stick with the feeling and not the fact of what, when, why, and where this feeling occurred.
Okay, in that particular scenario, though, the fact remains the garage door wasn't closed
Mm-hmm.
or wasn't locked. Your spouse or your partner came to you to say, you know what, honey, I thank you so much for going out and getting those groceries out the car for me. And you do such a wonderful job. But on last night, you left the garage door open and I felt so unsafe.
Mm-hmm. Mm-hmm.
You hear the tone.
And you stuck with the fact without elevating.
That's correct.
Man.
And gave positives because you went out and you did everything that needed to be done. You brought the groceries in, you came in, but you forgot to put the lock or you forgot to close the garage door. So again, I felt so unsafe when that happened. Okay. I know you didn't mean it.
Hey, no, go ahead.
No, I know you didn't mean it. That's a person could say that. I know you didn't mean it, but I was so afraid.
Okay, so
for you to hear me and validate what my feelings in that moment, my feelings were unsafe. So for you to validate in that moment, one could say, tell me what you could do.
And that would be the next question is,
okay,
from a response, what would you want to hear, or from a female perspective, from your mate in that moment? Because a lot of dudes, we just don't have the language sometimes, and we responded to respond, and not to validate and to make sure that we're understanding what your concerns are.
In that moment, in that little, what seems to be a minuscule issue, but I have had clients whereby that situation continued and it was a huge thing. But in that moment of that spouse or that partner telling that mate, I felt unsafe when you didn't close or lock the garage door. A simple, I'm sorry about that. I don't ever want you to feel unsafe. I'll check next time. Gentlemen, I'm sorry.
Did y'all hear that? I just want to make sure you're getting this.
Okay? A simple I'm sorry about that.
No, that's that. I think one of the things is in communication is that this whole thing that men are from one planet and women are from another, and we hear things differently, is absolutely true. So
absolutely.
With that being said, I'm gonna go into this next part of what communication looks like, and that's like, how can you tell that the approach that you're using is fostering understanding, or is it creating emotional distance?
One way to tell is change behavior, because if I have made sure to assert what it is that I need from you, or assert something that needs to occur within the confines of our relationship, and the behavior has, you have modified your behavior to meet said need, then the changed behavior means that you're hearing what I'm saying. It means that you care enough to modify. Even if you don't do it perfectly, it is about the effort. And that's whether it's male or whether it's female. Men can tell women all the time, especially women, we change our hair 1,000 times a month, it seems like sometimes. We can leave hair in the bathroom. That may be an issue for a man, right? We may not stop changing these hairstyles.
Okay. All right.
However, we may make, when you bring it to our attention, if we're not conscientious enough to pick up every little strand ourselves, once that is brought to us, it is our job. It is, because if we want to hear and we want to make sure there's harmony, there's peace within our relationship, not to blow off what he said. Pay a little bit more attention to the tidiness, how you are able to pick up your space. And when you see that there's a pattern of that behavior occurring, she's trying. Okay. She may miss it Monday, but she'll get it Tuesday.
Perfection is not the
It's
not
never
the
the goal. That's right.
It's not the answer. It's the attempt to.
It is the effort.
Okay. Now, let's kind of move that into a little deeper space.
Okay.
You know, where it may be finances. It may be
absolutely
infidelity.
Absolutely.
It may be co-parenting. You know, if there's a co-parent. Okay, that's all deep breath. Praise the Lord. All right. Co-parent is hard.
Absolutely.
And typically in those spaces, when we're co-parenting, there's this unrealistic thing that everybody's gonna follow your rules, right?
Rigidity.
Yeah, I don't know what that word means, but it sounded good.
Rigid, stiff, unmoving.
All right, thank you for that, Sarge. I appreciate it. Co-parenting is such a difficult space to be in because a lot of times we're still angry at our co-parents, that emotion. We are still in a space of disappointment, and we lack the empathy to understand that both parties are still probably hurt. And the end result is being that the children are suffering.
Children are suffering.
Children are suffering. So when parents are going through
spouses as well, or ex-spouses.
Or current spouses.
No, absolutely.
Right? And so understanding in that space, us against the problem. I see this with a lot of my clients in the barbershop that are going through co-parenting situations. And even with people that have professions dealing with this, when they go through it, it's like, damn, I did not realize what I was telling my clients. You know, I did not realize that I can say to someone, all you have to do is, or you just need to. That's not applicable when you're going through it.
That's correct. Minimizing.
Because now that you're in the midst of it,
when it hits your door.
Oh boy, it's a whole different monster, animal, beast, all of that,
that's
right?
That's correct.
So when you got parents that are blending families in your practice and going through the court part of it, that's hard space to be in, right?
Very difficult space.
How do you get them to, one, relax, realize this is not a instant fix, two, you have to play your part in this as well. What do you do as a counselor or therapist in those spaces when you encounter?
When we have individuals who come in, because typically therapy starts with one person makes that call, that they're having familial or family issues and concerns that have caused them such distress that they have to reach out to speak to someone. So one, I want to congratulate every person that makes that effort to reach out. You recognize that where you are is a toxic space. It is unhealthy. It is causing you undue stress and duress, and it is hindering your functionality. You can't stop thinking about it. There's a constant loop going on in your mind about all the problems that are occurring in your life, and you cannot manage it. And you have enough wherewithal or enough fortitude within you to pick up the phone. That is commendable. So we want to acknowledge where that person is in that moment. Yes.
Put your mask on first. You can't be helpful without helping yourself first.
That is correct.
I'm sorry.
That is correct. Very good. Put your own mask on. You're reaching out saying, I need some support in this area. Excellent. So when you find out where that person is, how that person is within the confines of this hodgepodge of things that they are dealing with, whether it's a child acting out, spouse acting out, children acting out, both spouses acting out. It can be an array of issues, but you're reaching out to say, I need help with managing this. We try to get that person collected first. How do you manage stress typically? What are the things that you do in order to manage stress in your life? Or do you have things? Sometimes we have people that have what's called maladaptive coping mechanisms, excessive drinking, excessive intimacy with other people. You know, you're just angry and you're doing things that are harmful to you rather than helpful to you. That's right. So we kind of assess those things and try to get that person tracking in a different way, if at all possible. Sometimes people may be under so much stress and the anxiety that medication may be introduced so that it can help you, because chemical imbalance is real.
Say more about the chemical imbalance, because
Oh my goodness,
you know,
synaptic nerves, serotonin, dopamine levels, all haywire because of how you're responding to what's called a traumatic event. When things are happening in your life that are so disruptive, that is traumatic. So we want to find out, assess where that person is to kind of get them to a level of stability. Then we may bring in everyone else. At least I like to. I like to see where that person, whomever made that phone call to me in my office, I want to speak to that person to find out where they are within the construct of the relationship. What is happening around them that is causing so much distress? When we find that out, then we can find out if they are a contributing factor
okay.
to the stuff that is going on around them, because sometimes the issue is you,
Ooh,
your behavior,
the issue.
your response to
Maybe you.
that. The issue could very well be you.
And so that's the part where we're talking about putting your mask on first, right?
Put your mask
and
on first.
understanding where some of your underlying traumas may lie.
Absolutely.
And this part of therapy and destigmatizing it as a bad thing versus a tool.
A tool.
This is a tool, just like, or a piece of equipment that you use to accomplish something,
Absolutely.
right? Like if I want to travel, I get in a car, I get in a bus, I get in a plane, but I can't expect to, and I like my little crazy analogies, to get in a car and fly to California.
Right.
Right. You got to use the proper tools to get you to the proper result that you're looking for. Right. So thank you for putting that into perspective from the partner perspective. You know, when we think about, you know, now co-parenting, looking at our children, I got a few things I need to ask you about that, right? And, you know,
breathe.
Kids, right? All right, so jump into this one, right? In a moment when your child challenges your authority or your emotions, how do you balance discipline with empathy?
Very good question. The healthy thing to do, because kids are going to be kids, their little personalities are typically shaped by the time that they're 5 years old. And typically their personalities are shaped by their environment. What do they see? Who are they emulating? Who is modeling the behavior in front of them? Because they have a tendency to replicate.
Hold on, wait a minute. Say that part one more time.
Who is modeling?
Who's modeling?
Who's modeling?
Whose image
are they replicating?
So a lot of parents are fighting themselves.
Oh, yes.
With their kids.
Absolutely.
Am I hearing that right?
You're exactly
so
right.
So you mad at yourself because your kid is acting like you.
A mirror image oftentimes.
Oh.
Absolutely.
Ain't that something?
So
okay.
How do you learn to deal with you?
Say more.
You have to hear what the child is saying, regardless of whether it's in a way that is well received. The words are still hitting somewhere. And if you know that you're a person, that's why emotional intelligence is so important, because you have to know how you respond to criticism, because the kids are going to give you the criticism. Ma, you said this, but I saw you yesterday doing X, Y, and Z.
You rolling their neck like that?
Yes. Yeah, and they will do it.
So what I'm hearing is, as a parent, you also have to have your active listening skills to hear what your kids are saying.
You have to,
right?
Whether you choose to or not.
Then what's the result when you don't?
Chaos.
Okay.
Chaos. Some kids are born with ability to be very rambunctious or boisterous, and sometimes we want those kids to be quiet, be in a box. You recognize the way that your child's behavior is. Again, it is formulated. Typically, their personality is fully developed by 5 or 6 years old, and it's replicated by what is going on in that home or whomever that child is spending that amount of time with. Who is the leader in that child's life? So it can be you, but it could be other people
Okay.
as well. Because if we're not as present in our parenting as we should be, the child is getting information and getting behavior modifications from someone.
Other examples.
Other examples.
Okay.
Who
So
is the model?
question is, again, a part of the same vein of thinking, when there are multiple kids in the house, say 2 to 5 kids.
Got a village.
That's a village, right? But most of the time, each child is going to need something different from you, right? And most parents don't have a psychology major or degree. They don't have a doctorate
They don't.
in this. So couple of things. Only jobs that you're going to ever, really important jobs that you have is being a kid, being a parent, and being a spouse. None of them come with training.
None of them. No manuals.
No manuals. So I'm going to deal with the kid right now, all right? And the parent relationship. We as parents, from my estimation, watching my clients in the barbershop, expect perfection out of our kids at all times. I think it's a very unfair thing. We do teach our kids to model our behavior. And when our behavior is horrible and they model it,
now you're mad.
we expect them to be the perfect kid, right? Or the kid that's not doing what I'm doing. And so what would you say to those parents that would be watching this podcast that's not recognizing they may be the issue?
We don't live in a box typically. Sometimes when you see something, say something. Sometimes people may not receive it. And I mean, in the role of mom, and you see that there could be conflict with myself and my little one, whether it be male or female. We have people that we are somewhat close with, that people, we have some confidants. We have some associates that we hear
and respect.
And respect. When you're missing the mark, it is important to have those types of people around you. But if you don't, it is important to see the child's behavior response to you. If a child misbehaves and they continue to misbehave in a way, what is your chosen method of discipline? We don't want to, what we're taught, the first thing is physical. That's not always.
I'm gonna beat you.
Yeah, that's not always the
sorry,
best.
I got rammed up for a second. My bad.
And people at our age, we already know what was going to happen. If you don't do this, you already know the result. That's not always. That's not always the first response. We want to try to see what is going on. The best way to help your child is to watch. If he misbehaves, okay, that's not the best thing to do today. And you find out what is going on, what was going on with that child prior to whatever infraction took place. Because typically children are not just doing something just to be doing it. Again, they've seen it, they've learned it, or they're experimenting. You know, kids don't know that the socket is there. They just see a socket. You teach them,
touch that hole right there.
Don't touch the socket, and you let them see why it's very dangerous. And then when they begin to show you that they understand, that's when we can say, okay, you very well know what this means if you do this. You see how we're communicating? Just this language. If you do this, you'll get hurt. We don't want you to get hurt. We love you. Don't do that again. That tone, getting on their level. If it's a small child, eye level to the child, to communicate with them in a little way that they are able to understand. Sometimes we would talk to our kids in an adult way, and they're 5, miscommunication.
So what I'm hearing you say is there's a way to communicate differently.
Absolutely.
With your child.
And we have to learn it.
And understanding why it's effective.
And when it's not.
And when it's not. But also giving kids explanations behind directives. Right? Because in the generation, I'm a 70s baby. And so My parents were 40s babies.
Uh-huh.
So do as I say when I say it,
Mm-hmm.
without giving an explanation behind it,
Mm-hmm.
often led to almost what do I they almost muted kids,
But think
silenced their
about why
voices.
though. We have enough wherewithal to understand that when we have parents that came from that previous generation,
The Jim
we
Crow
understand
era.
absolutely, because
Mhm.
not listening meant life or death
Mm-hmm.
in most
Mm-hmm.
instances.
Mm-hmm.
You are taught to respond to them because that can save
Immediately.
because that can save your life.
So now, is that a trauma response?
Absolutely.
Or teaching our kids traumatic reactions?
It's same.
Okay.
Because what really has changed since
Well,
since those previous generations?
a lot has changed, but a lot has not changed. So the fact that it's being recognized now, it's being seen more broadly, but it still happens.
It still happens,
right?
and it's still very dangerous because sometimes what we say,
you
need to respond right now.
Mm-hmm.
But now we have different language. We have barbershop therapy and people in the community who recognize that what is happening with our kids, they're not hearing us in the same way that we were.
The
urgency is not there.
Okay.
So we have to continue to teach our history, number one, in that regard. When it's something very serious, especially like being out with our law enforcement and things of that nature, we need you to respond immediately. There's no back and forth question, because this means whether you're coming home or whether you are not coming home. So everything is not that immediate, but we still have to learn when it is.
And
the scenarios matter.
I think that's part of the social cues that a lot of our kids miss, because they were not exposed to the things. Like I had a child in my chair years ago, and in the barbershop that day, we were talking about racism. And he looked at me, he was about 14, 15 years old. He was like, "Mr. Jimmy, what are you talking about? Racism don't exist no more."
Oh.
I mean, smart kid.
Oh.
But there was a level of shielding in his household, obviously, that led him to believe that racism wasn't a thing. And so, fast forward, I still cut that young man's hair. And he said, and I reminded him of that conversation when he was about 14, 15. And he said to me, "Yeah, I don't share that same outlook anymore, Mr. Jimmy. I understand that there are things that I was shielded from by my parents. And they did me a great job, but almost a disservice. Outside of those moments, I think parenting, getting back to the expectation of understanding from a child on an adult level. Right. And I think I have 3 kids now, and now 2 bonus kids.
Okay.
Right. And with that, I have to look at my kids, and my oldest son was my science project. Right.
Absolutely.
And I have to give him a lot of grace, because he took a lot of me learning. Now my younger 2, I can say I literally spanked my oldest one twice. And it was in my younger years, I was following the example of my parents. Now my 2 youngest, they've got a pop on the butt or a pop on the hand.
That's the grandkids.
And I'm old with this gray hair right now.
I don't have
the energy to do that.
That's right.
But I also matured and realized that the explanations need to be there with my kids, so they have the vocabulary, one, to deliberate through the punishment and hear the good information why they were being disciplined, versus it just being a violent moment that was unexplained. Right.
And that's important.
And so, with that being said, I want more parents to look at it like, now we not past the fact that if you willfully being disrespectful and doing things out of
Correct.
character
Correct.
when you've been shown, told, explained,
Mm-hmm.
and given grace
Right.
on multiple occasions.
Exactly.
Now I just got to get your hind parts.
We call those levels.
We call it levels. Explain those levels a little bit.
So like you said, you've been told, you've been shown, you've had your warnings, and then let the physical discipline be your last resort.
Okay.
That instead of your first one. And also you have to look at whatever the infraction is. All infractions are not major. So again, checking in with yourself. Where are you as parent when said infraction occurs? You already know they're going to do something because they're kids.
Yep.
Their little brain frontal lobe does not develop until 25. And I'm going to dare say now, 27.
72.
27 years old. That executive functioning is not there. So expecting a child to behave or react in a way that an adult who has the capacity is unfair. It makes no sense.
It's unfair to the child.
It's very unfair. So where are you as a parent? Because we are working. We got to cook dinner. We got to prepare for a podcast. We got to make sure all these things are occurring so that the child can have X, Y, and Z. So we are stressed.
But I also like to add that a lot of times when there is relational issues in the house,
sure,
the easiest person to take that out on is that child.
Sometimes it's unbeknownst to the parent too.
Yeah. Like I think a lot of parents, when they're going through stressful, whether it's with a partner or a spouse, or whether it's just the stress of everyday life, it's so easy for parents to turn and take that out on their child because they're one, defenseless, and two, there's no repercussion to the people that are closest to you.
Oh, but there is.
Talk about it.
Oh, but there is. When you continue to see the child begin to act out in different ways, in greater ways, or if you see the child begin to regress or withdraw, sometimes that is a direct result of your interactions with said child. So it is up to us as parents. No, we do not have a manual. No, there are no parenting classes, although I think there should be when a child is born. I think that a parent, whether it's a single parent, single mom, single dad, or dual parent household, I think that there should be a clinician
mandatory
that follows you throughout that child's life, especially for those first 5 years, because you're adjusting, you're learning to navigate your life with a new person in it, with a new identity, with a new set of goals, dreams, desires, because your child is an individual. So I think that should be definitely made mandatory.
So after 5 years, they get their license?
You may. If you have demonstrated that you are healthy in terms of your emotional regulation, in terms of your household functionality, somebody should be with you because we all need support in this thing called life.
That's right.
Marriages is good. We have two people that are married and they have a family, but the stresses of life don't stop. And you don't know when those stresses are going to hit or how are you going to react to said stressor. So it's important that we have this village to help us navigate so our children are not growing up broken, defeated, abused, withdrawn. These are things that we have to do because we wanted to have them, whether we did or we didn't, they're here.
They're here.
So now it's our responsibility to be responsible for them so that they can replicate healthy behavior that we have modeled.
Man, I'm glad we're doing a podcast because that was a lot and good information at the same time. So thank you again for imparting some of this knowledge. To add to that, I want to ask this next part of this question, and are there times when your tone, when your silence, when your indirect response might unintentionally model aggressive or emotional unavailability in your communication?
Absolutely. All of that.
Okay.
Absolutely. The best way I can think of is to pause before you respond. You don't want to react, because typically when we reactionary, it is not good.
Get your
Get your
teeth get tight and everything.
get.
Get them. Wrap a little
That is
t-shirt.
sometimes that's necessary though, because
Okay.
sometimes that's all it takes. Depends on the child.
Okay.
But you got something that's gonna push the limit. So the best way, or a healthy way, I can't say the best because someone may have better, but a healthy way that one can respond is to pause, take a few deep breaths, to gather yourself, to get your bearings so that you don't react aggressively, angrily, or harshly.
Mm-hmm.
Take a pause, take some breaths, step away before you respond to whatever that infraction is.
Now, I know for me, my dad was the dad that he was gonna have that button in his forehead. When he look at you, my mom, she might grab you and squeeze your arm and pinch your arm when you done something
You
wrong.
was worse.
I was a little bit. But growing up, now I'm not gonna take anything away from those experiences because some are warranted. I had an experience one time. My dad told me, "Stop throwing that ball against that porch," because I got a glass door right behind it. Soon as he went back to work,
Oh.
I was throwing the ball at the porch, at the steps, practicing my pitching. I got this. I'm a great pitcher. I got this.
Oh.
Oh God! Oh Jesus! Oh God!
It didn't work out for you guys. I
Lord,
assume.
he gonna kill me. He gonna kill me. Jesus. Now, parents know their kids, right?
Yeah.
My dad told me that morning before he left and went to work. Typically, when my dad come home, he gonna come through the back door. That particular day, I thought I was slick. I said, okay, Lord, I done figure this out. I done cleaned all the glass out. I done moved everything around. I got all the glass out of there. I said, he gonna look at that glass and he ain't gonna think about it. He ain't gonna think about it. That particular day, he went straight to the front door. He looked at the glass, stuck his hand in, and I heard my name, Jimmy Darrell.
Oh my gosh.
I think I passed out a little bit for a second, right? But
You already knew what it was.
your parents know your capacity as a kid.
They do.
Now, that was one of those moments it went from a 1 problem to a 5 problem real quick.
Yeah.
So needless to say, I got, the physical aspect of that because he told me.
You earned it.
He explained to me. He said, do not do this any longer. And as soon as he turned his back, I chose to disregard what he said. So from that perspective, my dad did a great thing. He gave me all the grace in the world in that moment. But a lot of parents don't give that grace. It turns into a 12 problem out the gate. You spill some milk on the counter.
Right.
You always doing this. So what would you say to those parents, if you don't mind looking into the camera and giving them some of that, that grace that we got to give our kids and stop trying to beat them into submission?
Absolutely. Pause. Take a breath. Step away before you respond. That typically can offset abusive situations, situations that escalate into traumatic events for your children. Check in with yourself. Pause. Take a few deep breaths, maybe even a timeout. You do not have to respond right then every time. And talk to someone about your frustrations.
Thank you.
Absolutely.
Man, listen. Hold on. Let's just pause.
Pause.
Take a deep breath.
Take a deep breath.
I ain't gonna kill you now. All right. Liz, I love the flow of this and how it's going.
Absolutely.
I want to move on and look at, workplace communication. Because, in your workplace can be your main stressor
Absolutely
in life.
can.
So
if you let it.
If you let it. We'll talk more about how not to let it, right? But in this case, when you feel misunderstood,
Mm-hmm.
disrespected, or overlooked at your workplace,
Mm-hmm.
how do most of your clients respond when they come in and talk to you about these things?
The clients are frustrated. They're unheard, underworked, overworked, underpaid. They are really frustrated. They are angry. And sometimes we want to look at what is it? What is your role? Is that role the best fit for you?
Mm.
Is your job the best fit for you? Now, we don't just say anything haphazardly like quit, because we understand that there is an income that needs to be made, that there
Mhm.
are bills that
Mhm.
need to be paid, that there is a lifestyle that needs to be established,
Need a plan.
or ones that need to be maintained.
Mhm.
So you want to make sure that you establish a plan of exit. If we determine that where you are is contributing to your the discomfort that you're feeling, you're so unhealthy, you're so anxious, you're so overwhelmed, you almost have a heart, you're having heart palpitations the night before you go to work.
Anxiety over it.
That's too much. That means that you're giving that place or whatever work that you're doing too much of you. We have to make sure that we're able to pivot, to find other modes of self-fulfillment and self-gratification. At your job, you recognize if they don't want to hear you, they don't like you, why are you giving people energy? Why are you trying to get something that you know that there's nothing there? You're expecting something from a whole. Let's come out of that hole and find you something else to do that fills your emotional cup, that fills you. That job is depleting and draining you. Do it until you're able to do what it is that you like to do. Denzel Washington, I believe, say you do what you have to do until that you can do what you want to do.
Right. I got a friend of mine named Chulo that I told him back in the day, you know, he said, man, I love music. This is one of the things I love to do.
Mm.
And he said, but I funding ain't there. I said, well, sometimes you gotta work hard to fuel your passion.
Oh, yes.
And
Excellent
it
advice.
requires you to actually go out there and get those funds to be able to do what you like to do.
Absolutely.
And it was just that stuck out to me
Mhm.
because the guy is amazing.
Okay.
One of my clients been with me for a long time, but he loved music.
Mm-hmm.
But you always have to have a income to fuel your passion.
Absolutely.
And so with that being said, um,
Well, I want to make sure I say, though, you don't want to be in a place where you're being abused and you're not documenting.
okay.
Now,
Say more about that.
Now you want to document everything that is occurring, because what sometimes personality conflicts, you may not be able to do anything, but we're talking about legal issues. When people are harassing you, people are doing things that in accordance with the EEOC, these are laws that you're breaking, if you have some type of disability that people are not adhering to. Now, that's a little bit different. You dot your I's and you cross your T's, and then you take that, you can escalate that.
Documentation beats conversation all day long.
Every time.
So even in those moments where you might feel, follow up with an email saying, hey, we had a conversation earlier.
That's correct.
And I want to make sure
that I'm clear
and clarifying what that conversation was about.
Absolutely.
Oh man, that's pretty powerful, because a lot of young people miss that. They get mad, they get upset, and they lash out, which get them fired.
And I applaud the young people, though, because they will leave.
Oh yeah.
Now some of it,
they like,
now some of it is a little reckless, honey, because you got a little car payment that you just. I'll figure it out. Now they are not they're not in the same headspace that we were in.
They're not in the same headspace we're in, because the older generation was on pensions. They were on retirement, being in one place for 30, 40 years.
Not now.
A typical young person in the workspace now is going to be there 3 to 5 years,
and that's all,
to move on to the next and best thing.
That's
which
correct.
I wish I had that thing,
Hispa, that gumption,
that go and move. So now In communication,
Mm-hmm.
do you address the issue directly? Do you avoid it? Do you express your frustration indirectly through, you know, I don't know, withdrawal or sarcasm, just your reduced effort at your job? Yeah.
Now, at my job, I'm very clear in my communication. This is what it is, and this is what has been done. Now, if you're continually met with resistance, and could be colleagues or it could be a superior,
Mhm.
you want to make sure that you're very clear in a respectful and professional way. These are your expectations. However, this is the methodology by which you have trained me to do this, and these two things aren't aligning. Now, can you look at it and share with me what you'd like for me to do with this? Because if it's a superior, that's their role to create a system by which their employees are able to carry out whatever that task is. Now, if it's a lateral person or a linear person, a colleague, our two ways may not agree.
Mm-hmm.
And
Mm-hmm.
if that person continues to give pushback, I'm not going to continue to go back and forth with you. You work your way and I work mine. We have, as long as we get to that same goal, our system is set up by which we are individual clinicians. We document differently. We speak a different language, but the goal is to always support said client. I don't go back and forth with colleagues.
Okay.
What's
Okay.
the point?
Okay. Now, I think when you're dealing in a lot of work situations, people often there's jealousy.
Oh,
There's willful,
ignorance.
willful ignorance,
Yeah.
and throwing people under the bus to make
Yeah.
yourself look better. As a person going into the job market, coming out of college, or a seasoned person
Mhm.
in those situations, what are some tools that can be applied when experiencing some of these things that we just talked about?
In my life, since I'm here as your guest, I'm gonna lean to my faith because I'm a believer, and the Word of God tells me that you can't speak wisdom in the ear of a fool.
Hold on, say that.
You
Say
cannot
that one more
speak
time.
wisdom in the
Jeez.
ear of
All
a
right.
fool. If the person is behaving foolishly, then there will be two fools if I continue to try to go back and forth with you to try to convince you of something.
Mm-hmm, mm-hmm.
I'm fine if you escalate it because I'm able to take my concerns to the person who is over us.
Okay.
Going back and forth with a colleague, trying to convince them of something, sometimes it's not well received.
It's a futile effort.
It's futile, especially if it's led with those jealousy, the envy, that spirit of contention that seems to be there. I can step away and you can think what you want to think. Let them. That's the let them theory. You let them think what they want to think, and you continue to do the job that you have been hired to do, and you do it to the best of your ability, and continue to document, because when it is a superior, though, who is causing the stress, now that needs to be documented and that needs to be escalated, because no one deserves to be bullied on their job. No one deserves to be harassed on their job. No one deserves that. And there are legal defenses in place to help you navigate those difficult spaces.
Okay. Now that's a word right there, and I appreciate it. I want to take a little different direction now, and we went through spouses, intimate partners.
Yes.
We talked about our kids.
Mm-hmm.
Talked a little bit about co-parenting.
Mm-hmm.
Now I want to go to that thing you can't choose, your family.
Oh, that family.
That family, right? And so from family and emotional distress and communicating, because situations like funerals,
weddings,
illness, holidays, illness, things of that matter. So during times of personal distress, anxiety, and emotionally being overwhelmed, how capable are you of being clear and communicating what your feelings are to your family members, which with the dynamic sometimes is an older sibling, a younger sibling, uh, a big cousin, a matriarch of the family. All of those dynamics jump into play, right?
Oh yeah.
So how do you help your clients to navigate those moments? Let's say with a funeral, because it's high emotion.
High emotion, grief. Different set of people, same principles. You know who you can deal with, who you are able to communicate with. Typically, you kind of know, but you saw every now and again when you have these situations, people are behaving a little bit out of their character because of the situation. More specifically, if it's a funeral, we know that grief
Brings out the worst in us.
It can. Not necessarily the worst. It's pain. You're losing something. You're losing someone. You're grieving the relationship. So people are reacting out of pain. And the underlying, when they're angry, the underlying emotion of anger is typically pain.
Okay.
So if you are dealing with someone who is acting out of character, you do have to give grace in these moments. But if you have Pookie, who has a pattern of disruptive behavior, who has a pattern of outbursts, who has a pattern of whatever that negative behavior is. It could be Ted. We don't know.
Right,
Whatever that person's name is. Ted is obnoxious. He's always been that way. You got to let Ted be Ted. You got to let Pookie be Pookie.
Don't expect anything different.
Reduce your expectation. Lower that bar. But also, distance is your friend. Because if you know the way that Ted acts, if he do it today, it's going to be a problem. You're going to have two Teds. Is that going to be helpful for the environment that you're in? Okay. Is your behavior, is the way that you are going to react, or because you gear up now, you get it, you have a plan set. If he says something today, you already know what it is. So instead of posturing yourself in a defensive way, you want to be offensive. I'm grounded. I'm hurting too. Acknowledge how you are feeling. Acknowledge the overwhelm that the day, because if you had to pay for it because so-and-so didn't have any insurance, if you had to host a repast because the church wouldn't do it because he wasn't a member, all these things.
So turn into an advocate.
That's correct.
Opposed to the defensive.
Opposed to being defensive. And sometimes you feel it's not fair. Why do I have to be the one who does things right? If you want to be the one who models responsible behavior, because you got little people watching, you have big people watching you, and they can learn something from the way that you address a situation or not, because everything does not require a response. If
Say that again. Say that again.
Ted are being Pookie and Ted, let them. You just keep your distance.
Believe people when they show you who they
Believe people. And don't get the fake person that comes in acting like they do all this grandeur and haven't done a thing. Let her have it. Because the truth is going to come out every time. And you don't have to join the foolish behavior. Everything does not have to have a response.
Okay. So what internal barriers provide you with the expressions to operate in that moment, right? Sometimes now it's you fighting yourself.
that pride, because you ain't gonna let Pookie and Ted talk to me like that.
Like this.
You got to fight through that pride.
How do you speak to people and give them so again, it's tools, right?
It's tools.
How do you give more people those tools to fight that urge to let my pride, jump on you like a bobcat?
Again, I have to lean into my faith. This is what helps me because you a few minutes ago you mentioned she's the matriarch, big cousin,
Mm-hmm.
the
Mm-hmm.
eldest. I
Mm-hmm.
fit that role.
Okay. All of the things.
All of the things. I didn't ask for it. I definitely did not. And my family, we are currently in a detrimental situation. We are caring for my mom, who is not in the best of health, but we have had to rally together. And sometimes the way that Uncle so and so may do something, the way that sister may do something, may not align with the way that I do. Someone has to say, "This is your area of expertise." You talk that person up. Nobody can do what you do, how you do it. And that typically is true. Stay in your lane. If this is
Okay.
not my area, why am I over here in your area? So learning where you fit and how you fit, and understanding that where you fit and how you fit does not fit everybody's box.
Okay.
You have to allow people to do what it is that he or she or they may do. That is growth. That is maturity. That keeps you from engaging in all this unnecessary tussling.
Mm-hmm.
It is futile because the goal is to make sure that whomever we're caring for, whomever we may be laying to rest, whomever's event this is, we want to make it shine. We want to be on our healthiest, because we can't say best. We want to be on our healthiest behaviors so that whatever is carried out can be carried out in a way that is decent and in order. So I lean to my faith. Now, everyone I see may not be a Christian, or they may not have the faith or that undergirding of knowing what is right and what is wrong in our eyes. That's not my role to judge. My role is to model healthy and responsible behavior.
Okay. Okay. So, man, again, this is like just information that so many of us need to dig into a little more,
Absolutely.
have a little more grace, have a little more empathy,
Yes.
know that we don't know it all.
We do not. And we cannot do it all.
You can't do it all. And so, with that being said, I want to ask one more caveat to the sandwich generation. We're in that generation.
Yes, we are.
Where you're taking care of parents
and children.
and you're taking care of children. What do you say to that group of individuals that how to keep peace in your house with your spouse because that sister-in-law or brother-in-law or they're not doing their part? The kids in co-parenting, the just allowing the space to with your partner in your home to support one another in those moments, because everybody's going to reach that space where you're going to have kids, you're going to have aging parents, and you're looking on both sides trying to figure out how to create that space for you and your partner.
Absolutely.
Because you're so busy. What would you say to that group of people?
I see you. I feel you. Because I'm there. And I know that it's difficult. I know that it is challenging. But if you, one, set boundaries. Boundaries are our friends. We have to manage expectations of people, because people will continue to dump on you if you allow that. So-and-so has it, she has it all under control, or he has it, he comes up with these great ideas to do X amount of things to reach the greater community. These are challenges, but we have to make sure that we are checking in with ourselves. If you are not aware of how you are feeling, if you are not acknowledging how you're feeling, if you're not truthful about how you are feeling, how can someone support you? How can you continue to support others if you are unhealthy? So we can't control the situation that we're in, this age range where we're sandwiched between aging parents and children. We can't control that. That's just life. And the issues of life don't stop. but how are we showing up for ourselves first so that we can show up for the others that we love?
Wow. Okay. Dr. Shaw, I really like to thank you
Thank you.
for spending a little time here with us on Barbershop Therapy. This has been amazing
Yes.
because just getting a honest and personal view of how therapy works
Mm-hmm.
from the professional side and your personal experience.
Absolutely.
You know, I think that a lot of our viewers will get something from this. Um, Tools to take home, tools to apply. Thank you.
Thank you.
Appreciate you
Thank you so
again.
much.
So this is Jimmy Evans, your host again with Barbershop Therapy, and with great gratitude, thanking you for being a part of this journey to bring families together, to bring mental wellness to our households, and also to just bring some understanding to destigmatizing what this looks like. So again, thank you again. My name is Jimmy Evans, and this is Barbershop Therapy, where we cut through the problems.